Hi, good evening. This is part of the female GI, female genitalia rather, exam. That's part of the chart. First thing we want to do is to introduce ourselves to the patient and explain the exam that we're about to do. We have assembled all the equipment, the spectra that we need on the side. After getting permission, we go ahead and wash our hands, wear gloves. We have draped the patient appropriately, and the patient is positioned in a lithotomy, but yet comfortable position. We want to unfold the drape, but then continue to maintain a side of line where the patient can see us. At that time, we introduce the patient to our arms and explain to the patient how our arms are going or our hands are going to feel. And per our class, it's better to use the back of our hands versus the fingers while approaching the genitalia. First thing we do is inspect the skin. We inspect the hair distribution. We are looking for infestations. We are looking for the skin for erythema, bruising, looking for any erosions. We are looking also for any discharge, anything like that, or odor coming from a vaginal odor. Labia majora, labia minora, we look at the clitoris, the urethra, and peri area, we inspect all that. And we use the specular, we warm it up with warm water, or we can lubricate it with lubrication, and then insert it at a 45-degree angle while going in at the introduce. But once we get into entry, we turn it to a horizontal position and then advance it all the way as far as we can go, going toward the sacrococcygeal area and straight down as far as we can go. And then at that time, we're visualizing the vaginal walls for any erythema or scoriations as far as we can go, and then stop and open the blades. At this point, we are looking at the cervical os, and at that point, we can, when we've found it, we can lock the blades. We can grab a brush and do a pap smear at that point. So we are satisfied with that, with the cultures that we obtain. We can, to take it out, we take it off just a tad with the blades still open, and then at that point unlock the blades and close the blades and pull straight out. You can turn it to where it's comfortable for the patient and remove it all the way. And that's the end of it. Now, to do a bimanual exam, you have to explain to the patient the importance of doing the bimanual, and at that time we use a different glove. We palpate the vaginal walls, we palpate the cervix and the fornices, and palpate the uterus bimanually. At that time, we're also looking to see the position of the uterus as well. We are feeling for the ragae, we are feeling for any discomfort at the cervix. We want to palpate bimanually, and also to do a motion to see whether the patient will have pain or say that they're tender. The ovaries are supposed to be non-tender, and that's normal. And they're about the size of 3.5 by 2 by 1.5. Any larger is a reason for concern. And at that point, we remove the hand, and the only two fingers that go in are the index and the middle finger. At that time, we help the patient back up, help her clean up, and reposition comfortably. Thank you. That's the end of our report.